This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PH.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition of Health Watch. Every Sunday, 8 until 9. It's the time and this is the place where we get you healthy, or at least we try anyway. Dr. Molly FANTASIA is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. We will both try to guide you through these difficult waters of health this morning here on the program. 855-839-1210 is the number in the studio. If you have a question at any time for Dr. Molly or a medical challenge that you want to run by her, 855-839-1210. 855-839-1210.
Hey, John, I'll tell you what, I've had another 6-day week. It's maybe 6.5 if I count the hours.
Yes. Yeah, that's right. I mean, you don't stop. You're like the Energizer Bunny. I mean, what is it?
I got to say the truth. Dr. Molly may not feel like the Energizer Bunny every single day. You know, God created Sunday for the day of rest. So when we're done here, I'm just going to R&R.
You know what, though? But you never turn off your mind about, because you're always thinking. Now, you came in this morning and you're telling me about my case, and I know that it probably took about hours of thought how you came about.
Well, I've been thinking about it, of course, I mean, because
but that's just me.
Right.
You have how many patients? I mean, so imagine this. So I don't even know. I called you the Energizer Buddy, but I don't know how you do it.
Yeah, I don't. Well, thank God. That's what I can say. Thank God. And at our age, John, we do have to realize that we have to get adequate rest. You know, all the same things our moms taught us when we were little kids that we were taught in kindergarten, right? We got to get rest. We got to eat right, drink enough water, and and really we also need to enjoy life, John. Joy. Well, quality of life.
Tell us about Innovative Medical. Sure. And how it's different and why it's different and some of the things that I was referring to. So talk about that.
Thanks, John. Well, fundamentally, integrative medicine is a group of collaborating healthcare providers in a cooperative type of mindset, where we have a belief. We are working right out of my primary care facility, but we have a belief that we'd like to really focus on quality of life issues for our patients, and we tend to do that by using natural substances to augment pharmaceutical substances should the need arise. So, for example, if you come into us and you have hypertension, and you've already seen maybe your own primary care doc, and you have 2 or 3 hypertensive meds, and you said, you're just not feeling well, yada, 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 and we go through this with the docs, and fundamentally, we find that maybe some of the reasons why you're feeling this way is not necessarily from the condition, but actually from the drugs as well. So it's a combination of drugs and the condition. Well, we try to help you reduce your drugs, not necessarily take you off, but help reduce them by using the natural substances, vitamins, minerals, amino acids, fatty acids, whatever, using the kinds of things you might find in a health food store. But it's our delivery system that makes the difference, hydration.
We were talking about this also before the show, the disclaimers on the new drugs on TV.
Oh, yeah.
And
all the new conditions we didn't know we had, right?
So your goal, anyway, is to try to get as little pharmaceuticals as possible.
Correct. And reduce those side effects. And we like to see if and of course, this has to be done with the auspices of my medical director. And again, she's a good example of why we do this kind of stuff. I mean, she has MS, and can you imagine, she came in with a litany of MS drugs that she knew she did not want to continue taking. She felt that her symptomatology was being developed based on the drugs as well as the condition. And guess what? She was right on.
Yes, she was.
And she looks like a different person.
She looks fabulous.
Yeah,
and,
God bless her.
I mean, you wouldn't know that she was
right,
she
having
was.
this. But you know what? That is the philosophy of our facility. So again, all of us work in conjunction, the nurses, the therapists, the docs. We all work in conjunction to really help a patient reduce their needs for the pharmaceuticals, make sure that we want to improve their quality of life, regardless of their condition.
You know, a lot of people have had a lot of success with your facility, and it's documented. But for those who haven't been there or thinking about going there,
Sure.
what could you tell them about this procedure and this hydration and all of that?
I think the most important thing, John, is people come in for the first consult, which is free. First, we want to know where they are in their continuum of health or illness, as the case may be. And we want to say, okay, what are you taking now? Why are you taking it? Hey, what kind of natural substances are you taking as well to augment these drugs? Or is the combination right for you? And do you have any lab work with you at that time? Which is very important. I want to see some of the quantitative data as well as hear the patient's story. Does it work? That's the next question they always ask me, and you do too. And,
Yes.
and I can
Yes.
only say that I think we can prove that in terms of laboratory results. But more importantly, I would say let's look at the quality of life of our patients.
And that's very important.
Right.
And many of them have said they've improved
Right,
overall.
right.
And I can tell you that. I've done that.
And again, the idea is, again, you have to understand we are a traditional medical hydration facility. Therefore, the first caveat that we always say is do no harm. We're never going to take you off your medications until it's appropriate to help you do so, and we would like to work with whatever physicians gave you the medications and have you go back and say, look, this is what's going on right now.
There are those who come for a couple of times. There are those who come for forever, like me. And there's in between.
Sure.
What can you realistically expect as far as treatments are concerned?
Well, let's talk about what you come in for. Obviously, the earlier you come in with some challenges, the better the outcome is going to be. If you come in and you're in stage 4 cancer and you need some cancer support, you're going to be with me for quite a while. If you come in with a chronic condition, you've heard us last few weeks ago, we talked about the Lyme and the post-Lyme disease. Well, that might take 15 weeks to do. So it may take 30 treatments, but twice a week. So again, but we start to see improvement many times in as little as 5 weeks. Doesn't necessarily mean you're totally in the clear, but we start to see the improvement and people start to feel better.
So it could be anywhere from 5 weeks to
30 weeks.
30 weeks.
Right. It depends on what you're coming in for, and the amount of time you need to come into the facility depends on where you are in your own continuum of health. That is extremely important. For example, I started another patient this week who has Parkinson's. Well, that's going to be a little bit of a lengthy process. She's relatively early diagnosed, but actually early diagnosed in that she has Parkinson's, but she's had these tremors for quite a while.
So what will you do about that?
I think we're going to have to look at probably at least 15 weeks with her. And I'm working on a particular protocol which we'll talk about later.
So it depends. It could be 5, it could be 10, it
Sure.
could be 20. It could
it's
be.
going to run the gamut. It really depends on where you are and what you're trying to do. Obviously, for our young guys who come in and they're looking for just overall wellness, they come in once a week, once every other week, and they're doing really well. And I love seeing that. So again, it depends on where you, the patient, is. Because remember, John, every single one of my protocols is patient dependent. I want to know where you are in your quality of life, what you're looking for, and what the quality of life issue means to you. So for some people, it's as simple as I only want to walk to the drugstore. For other people, it's about playing with their grandkids, which can be pretty rough, or swimming in their pool, 20 laps. It really depends on what the patient wants, where the patient is in their condition, and then how is our approach.
Now, you work with other doctors
As
far as specialists are concerned.
Yeah. I mean, I have a consulting oncologist. You know that. I know several neurologists. I have an orthopedic surgeon who's a friend of the facility. I mean, we work. I'm very lucky in that I have referrals for lots of my folks, and then hopefully they come back to me, and we can really tune them up.
We are coming up on our first break of the morning. The show is called Health Watch, and it is here every Sunday, 8 until 9, the live version anyway, on Talk Radio 1210, WPHT. 855-839-1210 is the number. And this is the time. I sound like a broken record. You got to call early because what happens is every week we get people calling at 2 minutes to 9. We can't help you there. But call early if you have a question or a comment or a medical challenge that you want to run by Dr. Molly. 855-839-1210 is the number here in the studio. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. And I'm your host, John DeMasi. Dr. Molly and I return after these words. We are back here on Health Watch, and the number that is the number to call for Dr. Molly Fantasia and the operators, they're standing by right now at Innovative Medical Associates, 856-489-0505 is the number, 856-489-0505. And we tell you this often, you know, you can really get a lot of your questions answered and your problem, at least you get a direction from Dr. Molly when you take that initial consultation. And it is complimentary. And it's about 20 minutes or so, and you'll really learn a lot. So do that. Call and schedule that appointment, 856-489-0505, 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. We are here on Health Watch every Sunday, 8 till 9, here on Talk Radio 1210, WPHT. The number in the studio, 855-839-1210. We were talking before the show, and Dr. Molly...
Yeah, I know.
This one is a little bit confusing, but that's what you're here for. Unimportant molecules that impact health. What is that all about?
Unimportant molecules that impact health. I've been thinking a lot about the research. I've been thinking a lot about the research as it's related to the food supply. And why am I thinking that? Because, you know, I am a stickler about the powders that we use for our extracts of our vitamins, minerals, amino acids, right?
And why is that?
Because I believe in God's ingredients. Food source. Very different from manufactured source. You know, you and I have the discussion all the time about vitamin C, you know, and lots of people think, well, it's ascorbic acid. It's the same thing. No, I said I believe that the body has an innate ability to delineate between food source and manufactured. And when you look at things like in the B vitamins, like folic acid as opposed to folate, the same thing holds true. So it gave me pause to start looking at the research out there and the loss of how some of the smaller molecules that we are used to or considered in foods that weren't considered required had substantially contributed to the chronic disease state. In other words, we know that what was determined, and this I'm saying is determined by the powers to be that put the food into our, our hands ultimately, that was important, that we have an erroneous belief that 50 vitamins, minerals, fatty acids, etc. were the only important molecules that was important in food in order to sustain life. Well, that may be true. And so some of the other things that I look at in the food sources of these powders were dramatically reduced because of the synthesis of the foods. In other words, the foods are adulterated. Organic powder is kind of the best if we can do it. And lately we're seeing more and more, I would say, advertising and data out there talking about micro phytonutrients. You hear about the powders and these drinks, the green drinks and things like that. So it's something that I really started thinking about in terms of the natural forms that I believe in. So one of the things I started thinking about were these molecules. And although they are unimportant, quote unquote, I don't believe that is true. Things like flavonoids, for example. I saw over, I think, several hundred PubMed articles on the reasons why flavonoids there was a correlation between low flavonoids in plasma and virtually every chronic disease. So what are flavonoids? Well, flavonoids are found in colorful vegetables. So if you eat like a Mediterranean diet, you've heard about flavonoids in this, And so one of the things it said that flavonoids actually improve the measures of health and decrease the disease states in many risk of diseases. The other thing I looked at, John, I talk about a lot in this show, I talk about quercetin, right?
Yes.
Quercetin. It's from onion, all right? It's from the skin of the onion. So what it happened is there was over 300 hits in PubMed about quercetin and its ability to actually supplement uric acid levels in people who have gout, this kind of thing. And also it improved the outcome in many of people in Europe of COVID-19. Can you believe this? And I use quercetin.
I know you do. Yes.
So one of the things is there's a remarkable diverse health benefits of these flavonoids. And I want to tell people that it's important to look at your source of vitamins. It's important, and that's something that separates medical hydration from spa-like hydration. Many times you're getting what is the manufactured vitamins, whatever. Yeah, you can go in and get vitamin C. Am I saying it's not going to work as an antioxidant? Not at all. I'm saying there are other components in these extracts that we use that help our vitamins do the job that we want them to do. Cofactors, John.
You give out a lot of information here on the show, and I'm just wondering, for us mere mortals...
And me too. Listen, this is hard.
How do we figure out, or how do we navigate this?
Well, one of the things we navigated in is that we realized that we have to look at our sources again, our food sources. So, there's a lot of junk on the market, and unfortunately, that's why I say when you go into the health food store, you pick up something and you say, oh, well, this is cheaper than the one next to it, right? Well, that may not be good.
There's a reason it's cheaper.
One thing. And the second thing is you can buy an expensive brand that's all pharmaceutically type manufactured. Well, that may not be good either because, again, they've extracted out the, let's say, the folic acid, which is not folate, which is what the body utilizes, especially for people that have a dysregulation in that pathway. They need the natural source, folate as opposed to folic. So there are so many things I think about when putting together a protocol. I'm looking at this. And when you look at flavonoids, they're critical for health. And you look at what they do. They can reduce inflammation on their own. They're free radical scavenging as well as the antioxidants. So think about using the right kinds of bees when you put together a vitamin C drip. That can help scavenge the free radicals. It helps in the production of the antioxidants, your own body's production. We've seen it actually decrease in the laboratory, decrease apoptosis, which is when the cells start going out of control. Now that's in the laboratory, but I got to believe that God gave that a particular ability to do that in the lab, and I'll bet anything it helps in the body as well. So that's just some of them. But I got to tell you something else. When I look at onions, when we use quercetin, it's the total flavonoids and the antioxidant activity that I believe makes our particular hydration a little better than others for certain conditions.
So it's important then to know the extracts.
Yes, I work very closely with several compounding pharmacists, as you know, and I love these guys because they know what they're doing. And assuming that FDA allows us to continue to use certain substances, that'd be a good deal. Something else I look at, I just had a patient who came to me and said, I'm thinking about indole 3-carbinol, and she said, I'm going to buy that, in the health food store. I said, do me a favor, make sure you're getting it from a broccoli extract. And she said, why? I said, because it has it has an unimportant molecule that can enhance the indole 3-carbinol. So again, we have to look at this. So organic Organic foods are higher in the unimportant molecules. So what I like to know is, are my powders generally from organic source? The answer to that is yes.
And now we know why.
Right. And so, yes, they're a little more expensive, of course. We not only need to know, we have to know that there are lower pesticide levels in these kinds of things. And it's important for us to know that when we're eating as well. Everybody knows, we went a little earlier, I talked about the Mediterranean diet. Well, that's great, but, if you're getting let's say, tomatoes that actually have some of these unimportant molecules in them that are hugely needed as cofactors for other things, can you imagine if you have something that is grown synthetically in the lab? Well, it's happening. Right now, a patient of mine said, guess what? We're going to grow synthetic meat. I said, what? I said, are you talking about from stem cells? Maybe that's one thing, because it should be an exact replica. But again, I say we look at everything we put into our body, right? Zinc. You've heard me talk about zinc. Now, I use zinc, in certain protocols. But zinc is critical for metabolism, but only if in the cells there are bioflavonoids that can increase the zinc production transport. So can you see how these things work hand in hand? They may be unimportant if and by themselves, but it's how they're used as cofactors that really help in the intracellular metabolism.
I'm listening to you, and I'm thinking, I don't want to go into a health food store unless I talk to Dr. Molly or Barbara. Somebody with
some real good and fine nutrition.
Right.
Like, I have a nutritional person who comes who sends several patients to me. She's excellent. She gets it. She knows that zinc is important and where we get zinc. Another thing, green tea extract. There's an extract in green tea that really is called, unquote, an unimportant molecule, but it also helps the production of zinc. And in the end, that's what activates certain other things. Polyphenols are another little unimportant. That's extracted from grapeseed extract, something I use repeatedly in our clinic. So again, and I was talking earlier about the patient I have with Parkinson's. We have to look at preserving our brains, and flavonoids enhance certain pathways that helps detoxification, critical antioxidant neuron protection. It decreases the risk of Alzheimer's, aging, autism spectrum. There's some data for that. So, of course, we want to look at this. And I might add, in terms of this, look at isoflavonoids and our hearing. You hear this all the time. There's an actual product out that talks about the flavonoids and how good it can be for our hearing.
We are at the halfway point of the show, and that means we have plenty of time to take your call at 855-839-1210. Dr. Molly Fantasia is here. The show is Health Watch every Sunday, 8 until 9, the live version here on Talk Radio 1210, WPHT. 855-839-1210 is the number. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And I'm your host, John DeMasi. We are both coming back with more of today's version of Health Watch after these words. We are back here on Health Watch, and again, operators are standing by right now at Innovative Medical Associates, and the number, 856-489-0505. You may want to write that down, because you say, oh, yeah, I'll call later on. And then, what was that number? 856-489-0505. Again, 856-489-0505. The website, innovativemedicalassociates.com. innovativemedicalassociates.com. A lot of good information on that as well. innovativemedicalassociates.com. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is the number here in the studio if you want to talk to Dr. Molly. 855-839-1210. I'm going to talk about some of your patients and some of the things that you're doing for them. the patient with Parkinson's, and
right,
we've talked
she's
about
brand
that.
new. Yeah, I spoke about a little bit about that in the earlier segment, but I spoke about this and the neurodegenerative diseases at length last week. And one of the things I want to talk about is I looked at all of the PubMed articles about the magnesium and magnesium sulfate and the delivery of that in the protocol. So of course I'm doing that. I tweak this protocol a little bit based on the patient as she had her very first treatment. And frankly, I haven't heard back from her because it was only on Thursday late afternoon. But I'm hoping that when she comes in this week, I find out how she's doing. But in our Parkinson's protocol, of course, I am also using LDN. I talk about that extensively, the low-dose naltrexone, and the pathways that works on. I also use things like the phosphatidylcholine. L-carnitine is another supplement that we would use. And, of course, undoubtedly, vitamin C. Now, I sent out for her blood work because I'm very interested. She brought some blood work in, but as far as I was concerned, blood work from March it's just too long. I want to see what her other antioxidant levels are, and I'm fairly confident that they're depleted at this point. So her and also, of course, the B vitamins. And interestingly enough, in her case, I am very interested in the fact of how well she can take the folate, because I do believe she may have a dysregulation on a particular gene that actually is necessary to utilize the B vitamins. So it's not good to just give somebody B12 or B6 or whatever. You want to make sure that the form of that can be utilized for an individual. And there it goes back to some of the things we spoke about earlier. But honestly, I think this patient is going to do pretty well based on what we're doing. Now, remember, first treatment out. I'll be able to give people a little update next week when I come in. I don't expect miracles because she's had this for quite a while. She's also working with our physical therapist in order to improve balance. And this is what I mean about like-minded providers. Here we are, Doc's working with her, I'm working with her, and I really believe that, of course, my physical therapist is working with her in this case. And I think it's going to be the combination that will help improve her quality of life. It isn't going to cure the Parkinson's, and frankly, they haven't really said 100% it's Parkinson's, but they're leaning that way. Bottom line is, what I want to do is see her get out of that problem. She's really walks in with a walker, and the tremors are pretty significant, John.
So does this make the case more difficult, given what you said, that she doesn't have certain things?
Yeah. I mean, if we have a dysregulation on certain gene synapses that won't allow us to metabolize our B vitamins well, and B vitamins are very necessary for neuro health. Of course, we're going to see, and neuroregulation, we're going to see a problem there. So, again, she goes out and buys all these B vitamins, but they're manufactured Bs, and they may not really be what she needs. So, really, it goes back to our nutrition, John.
And what are you going to do as far as further treatments? In other words, how many will you?
She's going to need. We told him, and obviously, you know how I am, John. I don't overpromise. Right now, she's committed to 10 treatments. I say let's measure her in the next 10 weeks. They can only come in one day a week. So we're going to see how she's doing and see if there's any improvement. But I got to tell you, John, even if it's a 5% improvement, that would be a big improvement for someone like her.
Especially given the difficulty of this case.
Right, exactly.
Okay, 855-839-1210 is the number here in the studio. If you have a question for Dr. Molly or a medical challenge, 855-839-1210. We're talking about some of the patients that are currently there at Innovative Medical Associates. We have the patient from Indiana.
Oh, yeah, they went back, okay. Nice young woman, very young woman. She has a baby 6 months old. So she was suffering from... she said she was suffering from all kinds of GI problems and this kind of thing. So I focused in on the GI situation, immediately put her on LDN, which we know has a wonderful effect on GI. In fact, even conventional guys are coming around to say, hey, maybe the patient needs to be on LDN. But I believe it's our methodology of the use of LDN, using it in the tincture, as well as using the nutrition that enhances the LDN experience. So one of the things that I looked at was I ran all her hormonal levels, because she had a baby 6 months ago, and I ran some basic panels, and I ran some neuro panels, including her serotonin level, because she keeps talking about that she was listless, etc. She had a very, very low serotonin level. And I'm keeping track of some of these patients who are coming in from Indiana, because it seems like a lot of them definitely have low serotonin. Now, there are certain nutraceuticals that we can use, including NAD, to help improve their serotonin levels. But this doesn't happen in, 2 treatments. This is the kind of thing, it's not holy water. We have to do this clearly utilizing certain nutraceuticals that we can't always use in the same drip, but alternate certain protocols within the protocol that we're using. And so, for example, the tryptophan may be one of them. So we use all of these things. And when she left, I gave her a script because I was fairly confident she was happy. She had less belly pain, as she put it. She said she was eating a little more. Interesting. She also claimed she was gluten sensitive. I ran the gluten test, and it didn't show that she was gluten sensitive at all. So one of the things that I find interesting is people come in and they believe they have this gluten sensitivity. And then you run some additional testing and you find out, well, they're not really totally gluten sensitive or gluten allergic. And sometimes that's even true with other foods. They'll say, well, I'm allergic to blueberries or something. And then you run the test and you see, well, they're really not. They're mistaking this because maybe they ate a blueberry with something else. So the bottom line is, patients like this, I believe, of course, there's a relationship between your head, right, the little brain, and the big brain. Your gut is your little brain. The big brain's up on top of your head here, and the relationship, it works because there's definitely a complete connection. You know that from the vagus nerve.
I'm listening to this, and I'm thinking, she's relatively young.
Very young.
And she's got these problems. Does that make her prognosis better?
Well, I hope so. I hope she follows the diet that we put her on, which is we told her to watch the carbs, and we gave her some other tips. We put her on certain nutraceuticals to take orally when she's home. We asked her she's going to come back in probably 4 to 5 months for a tune-up. I will run the labs out there. Doc will order the labs out there, and we'll do some telephone and Skype, counseling through the internet. And I'm hoping that she herself follows what we asked her to do, because she made some strides here in a week. She was here a week, and we were able to deliver quite a bit of the nutrients she needed. The other thing is, she was depleted totally in B vitamins. Well, that'll do it. Because think about it, and the hormonal issues everyone's heard about postpartum depression. Well, I wonder how much of that is really related to not just the hormonal levels being screwed up, but also the nutritional levels, that, people are nutritionally depleted of certain vitamins and maybe certain other cofactors that they just weren't getting in their food while pregnant. So it's complex.
Would she have to change her diet?
Well, she did. She's changing her diet, and she's following the diet that we set her out to. But I told her that her perception is she has allergies to many other foods. What I'm saying is, according to what we got back, and by the way, we did traditional testing. We didn't necessarily spend all our money in all the fancy testing, because she came up with all this testing. The point is, I say bring things in very slowly and see how the body reacts, because when she left, the situation in her GI tract had improved significantly. I'm not sure about the serotonin levels. She said she felt more optimistic when she left, which is good news. That could mean that we are raising the serotonin to a normal level. So we're going to have to wait. This is a wait and see kind of thing.
We are coming up on our final break of the morning, which means you still have time to call in with a question or a medical challenge that you want to run by Dr. Molly. 855-839-1210. That's 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. I'm your host, John DeMasi. We're coming back with more of today's edition of Health Watch after these words. Operators standing by right now at Innovative Medical Associates. And again, the number is 856-489-0505. They will be there well after we leave you at 9 o'clock, so don't worry about that. But if you want, you call now, 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you miss any of today's show, we have the affectionately known as the Sleeper Special. We have our Health Watch replay 4 until 5 this afternoon right here on Talk Radio 1210 WPH.D. We are going to the phones right now. We have James in Philadelphia. James, good morning. You're on Health Watch with Dr. Molly.
Hey, James. How are you? How you doing, sir?
I have a question about colorectal cancer with which I'm diagnosed. Is there a particular vitamin regimen that needs to be used to deal with the effects of the colorectal cancer on the immune system?
Well, first of all, can I ask you a question? Were you discovered by colonoscopy or?
Yes.
Okay. And did they remove the cancer already? I mean, what's your status right now? No. What are they thinking about doing?
Chemotherapy.
Chemotherapy. Okay.
I had a previous prostate cancer back in 2013.
Wow. Well, are you taking anything now for to enhance your immune system? I mean, you want to be careful too through the chemo, right? Because what you want to do is make sure that you're using an appropriate type of, let's say, nutraceuticals, not to interfere with the free radicals that they want to create in order to kill this.
I'm not taking anything right now. That's why I called to see what might be useful.
Okay. Afterwards, I would say once the chemotherapeutic is through, you're through your therapy, and you're on the road to recovery, I would do everything you could to enhance your immune system. And I would tell you that entails a little bit of work. You need to be on things to improve your own immune system to continue to make sure that you stay well enough that you get through the chemo as well. All right, so you want to eat right, you want to do what you have to do. Please call my office. You sound like a nice guy. How old are you? Just a quick question.
81.
You're a baby.
Oh, yeah.
Yeah, come on in and see us. Yeah, I will definitely, I would definitely give you a list of things that you need to do. You get through that chemo, and God bless. We'll be praying for you, James. God bless.
Okay, James, thanks for the
Thank
call.
You. Good call.
Charlie in Philadelphia. Charlie, good morning.
Charlie.
You're on Health Watch with Dr. Molly.
Hey, how you doing? I haven't gone to the bathroom, and I haven't gone to the bathroom in a few days. After like 2 days, I used to, when I'm self-venomous, when I'm throwaways, and I want a little bit.
Okay.
But
are you dehydrated, Charlie?
From what I ate the days before, I should have gone a lot. I haven't.
Okay.
I got dehydrated a couple of days. It was real hot out, and I've had that before where I got dehydrated and couldn't go. And after a few days, the doctor told me Miralax. Now, I got some Miralax yesterday. And
I don't
wasn't
know.
even saying on how much to take. My daughter said take a capful. There's no directions on it thing at all.
I
was pretty pissed off about.
Well,
but
don't be.
I don't have any discomfort or anything. I just don't feel like it's not coming down to go.
Well, listen. You need to be hydrated for this to work. Okay, you're not hydrated enough. You need to be hydrated. You need to start drinking more water. Hydration doesn't include drinking a beer or so. We got to get you.
Oh, no, I'm drinking ginger ale with ice, and I'm drinking water.
That a boy. You know, I was only kidding about the beer. You know,
and I'm
but
peeing a real lot, so I got to be hydrated, right?
no, not necessarily. We're talking about cellular hydration.
Okay. Maybe
Okay. Now listen.
Grapefruit.
Listen. I can't give you a recommendation because over the phone. Okay. But I would tell you that there is a tea you can brew that is cheap as anything that tends to help with this. Okay. You know, if you call my office, I'll tell you what it is. I just can't do it over the radio because everybody else will be jumping up and down that I didn't recommend their product. But it's cheap and it's effective. You hear me? You'll call me. You'll call me at the office. You'll tell me, guess what, Dr. Molly, it worked. Okay, so please call me.
I can call you today?
Yeah, sure. Call me today. I'll tell Fran, who's answering the phone, to give you the name of the tea.
What's your number again? 856.
John, that's John's job.
856-489-0505. 856-489-0505. That's the number. And you call after 9 o'clock, and Dr. Molly will be able to
Fran
help
will
you.
tell him.
Okay.
If I don't answer.
Thanks for the call,
That's great.
Charlie.
John, you know what I'm laughing about? I'm laughing about a simple thing can really wreak havoc with our life, right?
Yes.
Hydration.
Yeah, that's it.
Most of my patients don't have this problem.
Yes, that's true. Speaking of patients, you want to talk about this ALS patient?
Yeah, that's the other patient. She's a wonderful lady. She's up there in age. Listen, she's younger than us, by the way.
I know she is.
She's really lovely, has a wonderful family. I've been working with her. She went back to her neurologist. She's also doing some other integrative things. And he said there seemed to be a little muscle improvement in terms of what she could do. But I really didn't like the way she looked when she came in. I have to say this. And I started looking at her and I said, you know, we ran a thermometer check and her thermometer read like 99, which was like a low-grade fever, nothing to worry about. I spoke to both the registered nurse and the doc, and I said, you know, there just seems to be something else going on. So I said, let's draw some blood. I mean, let's hydrate her. Can't hurt. We can, you know, give her the vitamin C, give her the ALS protocol. But let's draw some blood. And I gave the daughters a urine container, and I said I'd want the first morning urine, and somebody bring it back to me tomorrow. She came in one day, and I said bring it back the next day. Well, lo and behold, they come back in, and I looked at the urine, and I knew right away that there was an issue. And I thought to myself, well, now you had just seen your neurologist. The point I'm making is, isn't it something what we do in this world right now, in the world of medicine? Everybody's focused in on their own particular specialty. And so we forget about the patient in total, the wholeness of the patient. I sent the lab work out. I asked for it to be done stat. I got the results back the same day, spoke to doc. She said, oh, my God, Mal, she has a urinary tract infection. Poor woman is on a communicator, could only tell us that she had pain down there, but nothing specific. She didn't mention chills or anything. I just didn't like the way she looked. You know, the beauty of what we do is we get to see you guys, right? And
That's right.
My nurses are trained to observe. And it's something, Dr. Ma, I just don't walk through there because I enjoy walking around the clinic. I walk through to look at you. Because you can pick up things, and God bless my nurses and my nursing assistants who are out there in the techs, because they know if there's a little change in power or something, maybe something else is going on and it warrants looking into.
So you're saying that everybody specializes in their thing, but
right,
they're not
it forgets
looking at
about the patient, the whole
picture.
patient.
Yeah.
And one of the things, as I want to say, is that there is the unity of disease and the unity of care. No such thing. No such thing. What we do is we focus in on the disease and we forget about the unity of care. And that, my friends, is an important process.
And that's a good way to end the show. That's going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates, 856-489-0505. Again, that's 856-489-0505. You can call now. You can call after 9 o'clock. You can call this afternoon, but make the call, 856 489-0505. Check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. And don't forget, our replay this afternoon, 4 to 5. If you miss any of today's show, you can catch it again this afternoon from 4 until 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Barbara, Lana, Donna, and Vicky. There's also Joanne, fabulous Fran, delightful Dee, and our medical assistant, Sandra, and everyone at Innovative Medical Associates. I'm your host, John DeMasi. Thank you for listening. We will talk to you next Sunday, 8 till 9, the live version here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.